Let's proceed to pattern discrimination, biomedical diseases. Modern biomedical disease entities can also be subjected to pattern discrimination. In fact, this is commonly done in the integrated practice of biomedicine and TCM, both in China and the West. Diseases such as chronic gastritis, diabetes mellitus, essential hypertension, multiple sclerosis, rheumatoid arthritis, endometriosis, depression, coronary heart diseases, and others present with different patterns of disharmony depending on their stage of evolution and the condition of the patient. This allows for a more integrated and individualized approach to diagnosis and treatment, which frequently allows for more effective clinical results. Pattern discrimination determines treatment. Tian Cheng Lun Chi. As previously explained, the diagnostic information obtained by the four methods is analyzed and interpreted to construct an image of the patient's health and pathogenic tendencies, such as the underlying pattern of disharmony, even if no actual disease is present. This image is what determines a principle for intervention, which in turn suggests to the practitioner which therapeutic tools may cure, alleviate, or prevent disease. Correct pattern discrimination is an indispensable prerequisite to effective treatment of disease in TCM. Same disease, different treatments, different diseases, same treatment. Tong Ping Yi Chi. Yi Ping Tong Chi. Because any given disease may exhibit different manifestations at different stages, we know the underlying pathogenic process also changes. As the underlying pattern of disharmony of a disease changes, so too must treatment. This is what is meant by the adage, same disease, different treatment. Conversely, certain stages of development of various seemingly unrelated diseases may be caused by the same underlying pattern, which makes it possible to use the same treatment for all of them. This is what is meant by different diseases, same treatment. TCM theory postulates that the body has a set number of possible reactions to pathological changes, each of which can lead to a large number of potential manifestations, that is, diseases, and that the evolution of a pathological condition may cause the body to react in different ways. For instance, 3 patients all diagnosed with type 2 diabetes may, according to TCM, present with 3 different patterns: yin deficiency with exuberant heat, qi and yin dual deficiency, and kidney yin and yang dual deficiency. Each of these would require different treatment. Health and disease is continuum. In order to better appreciate the potential of TCM diagnostic tool, it is important to discard the view that health and disease are 2 opposing static states. Health and disease occur along a continuum, a constantly moving dynamic process of adaptation to situation and circumstance, which can be influenced through treatment that is sensitive to its mutable nature. A patient requesting treatment must be diagnosed in order to determine the pattern of disharmony at work. However, it is understood that once treatment is implemented, the pattern can and will change as a result of various influences. Therefore, the practitioner must re-evaluate, re-diagnose, and adjust the treatment accordingly. At times, the pattern may change so dramatically as to require an entirely different treatment. This is where the adaptability of TCM's therapeutic methods like acupuncture, herbal therapy, diet, bodywork techniques really shines. Integrative approach. Ideally, all cases should be approached with a view towards integration, including comprehensive information gathering, followed by the interpretive approach of TCM pattern discrimination, with an open mind to the possibility of further investigation and treatment using the tools of biomedicine. The best of both systems can be applied to the greatest benefit of the patient. The temptation exists in clinical practice, especially in the treatment of pain, to resort to a more symptomatic approach to alleviating patient suffering and to lose sight of the larger integrative view in the process. It is important to avoid doing this, regardless of whether one practices biomedicine or TCM. In order to provide specific, long-lasting curative effects, it is frequent for practitioners of biomedicine to find themselves without a clear diagnosis even after numerous diagnostic procedures. The approach of the TCM practitioner requires no time-consuming sophisticated procedures, as diagnosis and pattern discrimination can always be performed, allowing suitable integrative treatment to be delivered without delay. We owe it to our patients to be comprehensive and look deeper than the outward manifestations to examine the functional relationships at work behind the patient's present condition and to address them with treatment. Thank you for your attention.